A flare is interesting. What a physician thinks of a flare and what a patient thinks of a flare are slightly different, but a patient kind of knows when they're in a flare because the symptoms they came in with come back, sometimes even worse. And we've done a lot of research around flare, and patients have told us that 5 things that matter most are pain, fatigue, stiffness, the ability to function, and the ability to participate in their usual roles and activities. And so we have actually defined the patient outcome measure for flare using those 5 key domains that are important to them. So we have a flare questionnaire where we can ask patients about those 5 things, and we can know the score and we can know if they're likely in a flare. The 3 key symptoms are pain, fatigue, and stiffness. And stiffness, I'm going to start with that first. We don't have a great longer measure of stiffness. Our groups are working on that. However, stiffness is most problematic often in the morning and the evening. It just sets on. It feels like there are bands around your joints and that you just can't move properly. You can't make a fist. You can't do what you need to do. You're in slow motion. And that tends to loosen up after a few hours if you're untreated, but once you're treated, it'll loosen up in something like 15 minutes. And maybe it won't even occur if you're really in remission. Pain is an important problem for patients in that they have pain of their joints, and that's like a chronic, throbbing, terrible aching that you just can't make it go away. And interestingly, people think they need something for pain, but they don't need something for pain. They need the disease controlled, because when the disease is controlled, the pain is improved. So that is true for the inflammatory pain of rheumatoid arthritis, which we consider to be a key part of the flare. But there are other sources of pain that many patients experience that I'm going to say is in between joints. So in the upper back, the lower back, between the knees and the hips, for example, or between the shoulders and elbows, for example. And that's in the soft tissues. And that is just as much of a problem for people, and we're trying to figure out solutions for that. When the disease first starts, and particularly if it's very active, patients, they know it's different. The best example is a patient will say, I got up, I got dressed, and I just want to go straight back to bed. You can't even function. It's that bad. You're exhausted. Once you're treated, and hopefully treated quickly, the fatigue subsides, but still persists. You're never quite normal. And we have not cracked that one either. We're trying to figure out how to improve people's fatigue. Partly, this could be due to energy conservation, meditation, yoga. All of these things help fatigue. The other part of it is we have to help sleep. So it's very clear that a lot of patients who have rheumatoid arthritis have difficulty with sleep. And so identifying ways to improve sleep will help fatigue.